Hello, and welcome to CAN TV 21. My name is Tina Francois Blue, and I am the Associate Director of Community Health Initiatives and Research for the Metropolitan Chicago Breast Cancer Task Force. And I have with me my guest today, Ariel Thomas, who is our Health Policy and Advocacy and Research Coordinator. Welcome here to our television program. The Metropolitan Chicago Breast Cancer Task Force is a nonprofit organization dedicated to eliminating racial disparities in breast cancer outcomes for women of color across the Metropolitan Chicago area. And we've been in existence for the past, since around 2008. So we're excited to have you here, and we're going to be talking about advocacy today. So for those of you who've been with us and been watching our show all along, we speak about a lot of different topics around breast cancer and breast health, health prevention, and health messages to really ensure that women know where to access services and access care. So for those of you who are new and this is your first time watching us today, I want to just share with you a little bit about the task force. Again, all of our programs and all of our interventions really are aimed to eliminate disparities in access to quality breast cancer screening and treatment. And the task force has programs and interventions that are focused around outreach, education, and navigation. So if you are a woman who needs to get your mammogram, give us a call. This is our information. We're at 300 South Ashland Boulevard, Suite 202. Our phone number is 312-942-3368. And our website is www.chicagobreastcancer.org. Also, we do a lot of quality improvement work. We work with the health facilities around Metropolitan Chicago and around the state to ensure that the breast health services that are provided are in fact quality services, and that cancers are detected early and they're small when treatment options are their most optimal, and where there's the highest survival rate. And then lastly, and leading into our topic for today, is our advocacy efforts. And so I am very excited to have Ariel talk to us today about advocacy and some of the work that she's been doing and really leading for the task force. So Ariel, how are you doing today?
Well, how are you? Thank you so much for having me, Tina.
Great. So can you tell the audience a little bit, what is advocacy? How would you define that or describe that?
Right. Well, advocacy is taking a stand on a certain position and basically galvanizing and talking to our legislators to educate, those lawmakers about the issues that we care about. So essentially voicing our opinion and making that opinion be known to our legislators.
That's really, really important. And so what does the task force do? What are we doing? What's the task force doing around advocacy? What are they advocating for?
Right. Well, in terms of advocacy, our main annual event is called Advocacy Day, where every May we go down to our state capital, Springfield, Illinois, to advocate for certain asks or things that we feel strongly about at the Metropolitan Chicago Breast Cancer Task Force. Historically, we advocate for full funding for the Illinois Breast and Cervical Cancer Program, or IBCCP, as we'll probably refer to during the show today. So we advocate for full funding for that program. This year, we're advocating for $11 million to be funded to essentially make sure that all women in Illinois have access to high-quality screening services, no matter their income or insurance status. Also, this year, for our second ask, we want to really fight for the implementation of what's called the BEST Act that was actually written into law by our governor last August, but it hasn't been implemented yet. And essentially, that law mandates high-quality availability of services for women who have Medicaid. So essentially, being able to provide a breast center of excellence in any Medicaid network, which is really crucial when women are diagnosed. You want to be able to get the highest care possible. So to make that accessible to all women in the state is really important, and we need to implement that. And lastly, the task force is closely partnered with the American Cancer Society Cancer Action Network, and so we are in unison in fighting for the advancement of the buying age for tobacco products to 21. Okay. It's called Tobacco 21. So those were our three asks this year for Advocacy Day.
Wow. So can you tell us a little bit more about what was? Actually, we have a caller. Can we go ahead, caller? What was your question?
Yes, good evening, ladies. How are you?
Hi, how are you? Thank you for calling in.
No problem. I definitely want to support the efforts of the Chicago Breast Cancer Task Force, but
Wonderful.
what I'm really commenting on is the term advocacy or being an advocate. Now, from my understanding, Bruce Rauner is holding up funds. There's a problem with getting the budget, which I'm sure affects you guys, right?
Right.
Okay, so why don't you guys, understanding that the way you get money, the way that you're able to survive is through the public officials, you got to create a report card. You got to create a report card. You got to identify who are the friends of the Chicago Breast Cancer Task Force, and you got to have a scale, a rating system, so that you can clearly identify who's not really helping you, who's not returning phone calls, who's not being in support of your efforts. If you take that bold stance, then you'll get more. You'll be respected more because you're going to take a stance and you're going to almost to a degree, I would say, I won't use the word jeopardize, but you'll be putting people on notice that you're talking about saving lives. And if you're talking about saving women's lives, then there can be no equivocation. You're either with us or against us, right?
That's a very good point. Thank you so much for calling in and thank you for sharing.
Yes, indeed. Absolutely. We actually implemented what we'd call a legislator profile, which was a great idea from one of our former interns, to essentially have listed the bills that legislator has passed and essentially have a type of voting history for each legislator. So each lady or gentleman who joined us in Springfield has something. So if they're not already familiar with their legislator, they know how they voted and what they've done, what committees they're a part of. So that's an excellent point, and I think we should definitely take that, and run with it and do more to really educate the folks who do work with us in terms of advocacy, to really educate folks about their legislators because they do work for us. So that's an excellent point.
Thank you again. Appreciate that. So again, can you tell me a little bit more about the day itself? So, or rather, before we get to the day itself, planning. So, there's a lot I'm sure a lot that goes into pulling off this event. So can you tell me a little bit more about who came with the task force to Springfield and how was that process in connecting and letting people know about the day?
Right. Well, we definitely reached out to a lot of our community partners. We're really fortunate to have a lot of strong allies on this topic. So reaching out to different church groups and cancer ministries, groups in the Latino community really came through and full support. Also, we have a wonderful outreach staff person, Donna Lynn, giving you a shout out, who goes around the community every day and has made enormous relationships and maintained relationships throughout the city. So, with all of that in a matter of, honestly, a couple of months, we were able to fill essentially 3 busloads of women and men, a couple of men, down to Springfield. So we definitely, always look for more community partners. If you're interested in joining us, I'm actually getting ahead of myself, but if you're interested in getting involved in some more programs that we plan to be implementing soon, please, contact us. You can email me at advocacy@chicagobreastcancer.org, or you can give us a call at 312-942-3368. So we definitely have a lot of things that we like to plan, and we love to hear from you because these ideas are great. We are implementing, some new programs, and I'm definitely looking for suggestions. So, but in terms of coordinating, your general event coordinating process, lots of communications, emailing, phone calls. For people who would like to organize a large event, definitely capacity was a huge issue, so that's definitely a lesson learned. Essentially, I'm the only advocacy staff person at our small organization, so it was definitely challenging, but with the support of all of our staff members, with, the nuts and bolts things like folders and things of that nature, we were able to come through.
Wonderful. So I think we have another caller. Caller, go ahead with your question.
Hi, I'd like to know if the current budget cuts will have an immediate impact on women's health care.
That's a very good question, and yes, those budget cuts, even just the kind of the cuts that have been going on over the past, the past few years, there's been significant impacts to the Illinois Breast and Cervical Cancer programs, and also navigation partners who connect and partner with the Illinois Breast and Cervical Cancer program lead agencies as well. Ariel, would you want to speak a little bit more to that as well?
Yes, definitely. Unfortunately, every year the funding has decreased for the IBCCP program that provides these life-saving services for women all across the state. So absolutely, the budget cuts would have a terrible effect on women's lives, on families, and we actually were able to get some great media coverage and some coverage for a woman who, without IBCCP, we don't know if she would be here. She was diagnosed with cancer through the program, and she would not have had access to screening to get diagnosed and get the treatment that she needs and that she could afford without that program. So it's essential that the state funds this program. It's a top priority. It should be a top priority for our lawmakers.
And I think right in line with that question, we can kind of jump a little bit to another question that I have for you. I think a lot of the assumption has been that the Affordable Care Act is kind of replacing the Illinois Breast and Cervical Cancer program, so it's not needed anymore. So would you like to speak to that that misinformation or that misconception?
Right. While the Affordable Care Act has been a win, many people have become insured through that mandate. But unfortunately, many folks have not gained insurance coverage since that Affordable Care Act has come into effect. Only about 36% of eligible women who seek services through IBCCP have signed up for insurance. So that means the vast majority of women who are eligible for IBCCP are have not signed up, so they are still uninsured. So they still would need this program. And just to make a note, so IBCCP is not only for women who are uninsured, but also women who are underinsured, which means that you may have health insurance, but that insurance does not cover your screenings, or it's insufficient in covering what you need in terms of getting screening or treatment. So that's where this program comes in to fill in the gap. And unfortunately, there are many gaps in our healthcare system, and this is a program that is vitally needed.
And provides a safety net also for those newly insured women who have deductibles that they're not able to cover. So women who can pay the premium, but once they need to go on for further diagnostics, the Illinois Breast and Cervical Cancer program has been very, again, life-saving, because once you get to that point of, that there's an abnormal mammogram, time is important, and actually seeing it through the rest of the process to ensure that it's not cancer is necessary, and that program does provide that support. So again, let's go back to the day itself. So can you tell us a little bit about, how it was, and what did you guys do actually at Advocacy Day?
Sure. So as I mentioned, we boarded 3 buses from different parts of the city very early at 5:30 in the morning. We departed around 6 a.m. and took a 3-hour drive to Springfield. Once we got there, we were greeted by our partners at the American Cancer Society, and we had a welcome, and we're very fortunate that one of our task force ambassadors and a breast cancer survivor, the very beautiful Alicia Cook, was our spokesperson to say, and she provided the welcome, as well as an ACS volunteer, and we sort of went into what to do, how to meet with your legislator, how to communicate your asks, how to be polite but assertive. And I should note that we did have some training on the bus ride down, so folks were able to get familiar with their legislator and how to speak about these issues beforehand. So after the welcome, we had lunch, and so we were able to assemble in teams. So what's really great about Advocacy Day is that you're able to meet with folks from your district. You may not know them beforehand, but you assemble in teams, you get to make some new friends, folks who live by you, and get to know each other, get to know why each, one of your teammates is there, has taken that day, a whole day to dedicate to advocacy for this important event. So that's really powerful. And so after lunch, then the main event, begins, which is to meet with our legislators. So the teams go into the Capitol building and try to essentially pull up their legislator either from their session, where they go to the rail, and there's a process where they can give a clerk a card with the legislator's name and write their name or their team's, a list of names on the other side of the card and request that the legislator comes out to meet with them, or if the legislator is in their office, and they can meet them in their office. So that is the crux of the activity, is obviously meeting with our legislators. And
how are you all received by the legislators?
Oh, it was wonderful. We got a lot of great feedback. A lot of folks were able to meet with their legislator, which was awesome. We do have what's called report back forms. So, as we try to improve every year, we want to see, okay, were we able to meet with our legislators, and how can we, coordinate this differently to make sure we get make the biggest impact. Of course, not everyone was able to meet with their legislator, and when that's the case, they're able to leave what's called a leave behind packet that has our asks and our fact sheets and things that we care about, has that information so that legislator can look at it. And of course, we communicate with our staff person about, our issues, our priorities, and the team will leave contact information. So we do stress that, it's not just a one-day event. Definitely, you want to continue the conversation and meet in your district, your legislator, your state representative and state senator, that they have a district office in your community. So that's definitely a great opportunity to set up a meeting, assemble your own group. And this is something at the task force that we actually intend to do, is to begin what's called advocacy working groups. So if you'd like to be a part of that, please do contact us. Please give us a call at 312-942-3368, or feel free to email me at advocacy@chicagobreastcancer.org.
So would you say, what are some of the challenges to, one, kind of coordinating and just kind of hosting a campaign like this, and then two, what do you think were some of the challenges, for the ladies and getting our voices heard?
Okay, so challenges, I would say definitely, again, capacity. So, and just, you would think that, coordinating, making folders or something, a task like that, it wouldn't take as much time as it really does. So really giving yourself ample amount of time, more time than you think you would need, because as you know, things happen, when it's crunch time, there's always kind of different things flying in the air. So just to be prepared and to take a deep breath, and it was awesome. So it was an awesome day. Everything went, perfectly. But I would say, definitely plan ahead, contact your legislators, definitely, stress to your group to definitely reach out and contact their legislators individually, just so that the legislators know that as a constituent, I have concerns, I have things that I want you to hear about, and this is what's important to me. So it's very important that we as constituents reach out to our legislators and communicate with them. So that's very important in terms of preparing for this type of event. And I would say, to your second question about what were some challenges for the ladies, for the participants, those are the same thing, not necessarily some not being too familiar, with their legislator. Also,
were any of them shy? Were they? Because it's a little intimidating.
Right, it is a little intimidating. You have folks in suits, and you're in a large, like a very regal style building. Never been there before. But I think, after the day goes on, people get more comfortable, right? Because it's a public space. This is our building. Taxpayers pay for this building to be maintained throughout the year. So, this is really our space. So, yeah.
Empowering to have your voices heard.
Absolutely. And we got a lot of great feedback that folks really want to come back and do this again. First-time participants were really encouraged And they may have started off kind of weary, didn't know what to do, but they were really encouraged and they enjoyed it. So it was great.
That's wonderful. And so what is on the agenda, or, what are some of the next steps for advocacy efforts for the task force?
Right. Well, as I mentioned before, we are very excited to begin what's called our advocacy working groups, where we want to facilitate advocacy on the community level. So not just only, the Metropolitan Chicago Breast Cancer Task Force organizing an event, but us facilitating you as a community member, as a constituent. How can we help you, advocate and talk to your legislators, your aldermen? So we're really interested in doing more work in the community on a local level, in the city level. So this is what we would like to do. So,
because really the training that women and men, when community members are kind of go through this process, they can then use that to also advocate for other issues that are important to them as well.
Absolutely,
right?
Absolutely. Great opportunity, great experience for public speaking. Great opportunity to show your kids what advocacy is about. This definitely can bring your, preteens, teenagers. Why not? This is a civic experience, so I think it's a great opportunity for everyone to get involved, and we welcome men to come too. So it's not just, women can advocate for breast cancer issues. All people. It affects everyone.
Very important. And I think it's important to also note that we may complain about a lot of things when we're at home or we're in the car, but these are opportunities where your voice can be heard, and the legislators actually do take into consideration what you are saying, and it does matter to them. And so the more there's power in volume, and there's power in all of us kind of coming together and sharing our experiences and sharing the things that are affecting us and that we're concerned about. So this is very exciting, and I want to again just let you know, if you're interested in participating in any of our advocacy efforts, or you're just wanting to know more information about advocacy in general, we're the Metropolitan Chicago Breast Cancer Task Force. We're located at 300 South Ashland Boulevard, Suite 202. You can give us a call at 312-942-3368, and our website is www.chicagobreastcancer.org. And our email, again, if you want to email Ariel to get more information, or to volunteer to sign up for some of the other efforts that we'll have coming up, advocacy@chicagobreastcancer.org. So Ariel, can you just tell us a little bit? We have a few more minutes left. So can you tell us just a little bit about your background and your what is it about this the work that you're doing that is most meaningful to you?
Oh, thank you for asking. Very nice. Well, actually, my background is in science, social sciences and basic sciences. I have a degree from Howard University in anthropology and a master's in science and biology from North Carolina Central University. So,
That's awesome.
Thank you. So I'm very interested in research, but, I really, just that social science piece, really like applied and what affects the community. I really enjoy that, and so I think that's why I gravitated to more of a organization that is really rooted in the community, where I can see, the effects of my work. So that's pretty much my background, and I'm interested in, like I said, like more of empowerment and partnering with other folks. So that's why I'm really excited to be in this role. Yeah.
So thank you so much again for that's our show for today. Again, please let your voices be heard. Contact us. It's very important for us to really support the Illinois Breast and Cervical Cancer Program, and actually support the BEST Act to ensure that women have access to quality breast health screening and treatment services, to ensure that they're living and thriving from breast cancer and not dying. That is our show. Thank you so much for calling in. Those callers, those were really great feedback and really great questions. Again, if you need to contact us, this is our information, 312-942-3368, www.chicagobreastcancer.org, or email at advocacy@chicagobreastcancer.org. This has been a wonderful show, and please, we'll be back again on the third Tuesday at 5 o'clock. We'll be bringing you more really important information about maintaining your health and living a happy and healthy life. So thank you.
Thank you.